Today we're diving deep into the One Big Beautiful Bill Act, signed into law on July 4th, 2025, and what it means for Medicare users and retirees. If you or someone you know depends on Medicare, Medicaid, or Social Security, this one affects you. This bill is sweeping. It slashes over $1 trillion in Medicaid funding, triggers nearly $500 billion in automatic Medicare cuts starting in 2026, and offers a special tax deduction for seniors, but with serious strings attached. I'll walk you through the timing, the eligibility changes, the expected effects, and most importantly, what steps retirees can take now to protect themselves. In the next 25 minutes, we'll cover a quick legislative background, how the bill passed, what it includes, and why it triggers automatic cuts under the PAYGO rule, a detailed look at Medicare, what services may be reduced, how provider reimbursements can be squeezed, and what it would cost for you. The so-called Social Security tax elimination, actually a temporary deduction, and the pitfalls created by the $1 more rule, and concrete planning advice to avoid tax traps and protect access to crucial health services. By the end of this video, you'll know exactly what the law does, how it might affect you, and what you can do next. So let's get started. All right, so let's break down what the One Big Beautiful Bill actually is. On the surface, this bill was marketed as a patriotic, pro-senior, pro-tax relief package. It passed the House of Representatives on July 3rd and the Senate on July 1st, with the Vice President casting the tie-breaking vote. And then on July 4th, the President signed it into law. Supporters are calling it a game changer for seniors, but opponents are calling it a Trojan horse for entitlement cuts. So what's in it? Well, the bill has two major parts. First, it delivers temporary tax deductions for retirees. So if you're 65 or older and earn less than $75,000 a year, you'll get a $6,000 federal deduction on your Social Security income. Married couples earning under $150,000 a year, you'll get $12,000. But, and this is the key, this deduction only lasts through 2028. Second, the bill includes over $2.8 trillion in a new deficit spending, mostly because of massive tax breaks for businesses and individuals. And here's where it gets controversial. Because of something called the PAYGO law. When Congress increases the deficit without offsets, automatic spending cuts kick in. And that's what's triggering the $500 billion in Medicare cuts and over $1 trillion in Medicaid cuts, unless Congress steps in to fix it, and fast. The bill also changes eligibility rules for Medicare and Medicaid. For example, certain legal immigrants who were previously covered under Medicare and Medicaid could now lose access by 2027. So while headlines focused on tax relief, the real meat of the law is a fundamental reshaping of how we fund healthcare for older Americans. In short, the bill gives a tax break with one hand, while potentially slashing services with the other. Now let's talk about what this bill does to Medicare and why so many people are nervous about it. As we mentioned earlier, because the bill adds trillions to the deficit without paying for it, it triggers something called PAYGO, short for pay as you go. PAYGO is an automatic budget enforcement rule. If Congress increases the deficit through tax cuts or spending increases, PAYGO automatically cuts funding from mandatory spending programs to balance it out. And guess what's on the chopping block? Medicare. Beginning in 2026, we're looking at about $50 billion per year in automatic Medicare cuts, totaling to almost $500 billion over the next decade. Now you might be wondering, is this going to affect my Medicare Advantage plan? Will I lose my coverage? Are my premiums going up? Let's walk through what's most likely going to happen. Number one, cuts to provider reimbursements. The largest impact will come from reduced payments to doctors, hospitals, and Medicare Advantage plan providers. That doesn't sound like it affects you directly, but it does. Lower reimbursements mean fewer providers may accept Medicare patients, doctors may limit the number of Medicare appointments they take, some clinics or specialists may stop taking Medicare altogether, especially in rural or lower income areas. And Medicare Advantage plans may cut back on additional benefits like dental, vision, gym memberships, or even hearing aids to offset these lower payments. Number two, slower claims and authorizations. When Medicare's funding is squeezed, administrative processes tend to slow down. We're already seeing this with claims backlogs and prior authorization delays. These cuts could make that even worse. So if you're getting a knee replacement, cataract surgery, or even physical therapy, you could face longer wait times, more paperwork, or possibly delays in approval for medical necessary services. Number 3, potential out-of-pocket increases. Medicare has fixed cost-sharing rules, but when providers are reimbursed less, they may compensate by increasing what they charge patients within legal limits. This could lead to more doctors choosing not to accept assignment, leading to balanced billing. Or they could have higher copays for certain services or stricter formulary rules on Medicare drug plans to reduce spending. It's death by 1,000 cuts. None of these changes individually sound devastating, but they add up, and they affect real people who depend on Medicare for life-saving care. Number 4, supplement plans could become more expensive. Medigap providers, especially Plan G and Plan N, may raise premiums if more providers drop out or shift costs. Why? Because Medigap plans are picking up the difference when original Medicare underpays or undercovers. And if you're relying on a Medicare Advantage plan, expect your maximum out of pocket to slowly climb. It's already pushing $8,850 in some cases, and that number is expected to grow. Number 5, immigration-related eligibility changes. Starting in 2027, some lawful immigrants, people here legally, with work history, paying taxes, will be barred from enrolling in Medicare. That includes certain visa holders and even some green card residents who haven't met the new 10-year residency test. Now, this doesn't affect U.S. citizens or permanent residents who have paid into Medicare for 10 years or more. But this could affect aging parents sponsored through family reunification visas, some refugees or asylum seekers, and people who are on the edge of eligibility. For families who care for an older loved one on limited income, this could be devastating, especially when combined with the cuts to Medicaid, which we'll get to next. Now, it's important to say this: you're not losing your Medicare card. Your plan isn't getting canceled overnight, but these cuts will be felt slowly, quietly, and in the services you receive, especially if Congress doesn't act to override the pay-go. So if you're between 65 and 85 and you're thinking, will this affect me? The answer is absolutely. Maybe not this month, maybe not even this year, but when you can't find a cardiologist in your network, when your Advantage plan cuts dental benefits, when your Part D plan stops covering a med you've been taking for 10 years, you'll know why. Next up, let's talk about Medicaid, because this is where things can get really serious for people in or approaching retirement, especially those needing long-term care. While most people think Medicaid is only for low-income individuals or younger families, the truth is that millions of seniors rely on Medicaid for essential health care, and not just health care, long-term care, like nursing homes, assisted living, and home health care services. Here's the problem. The One Big Beautiful Bill cuts $1 trillion from Medicaid over the next 10 years. That's one of the largest Medicaid reductions in history. So what does that mean? Number 1, harder to qualify for long-term care. Right now, if a senior's income or assets fall below a certain level, they can qualify for Medicaid to help pay for nursing home care or home-based services. But under the new bill, starting in 2027, Medicaid recipients will face monthly income and asset verification, tighter look-back periods for asset transfers, and delays in processing applications due to new documentation burdens, which means more paperwork, more denials, and more seniors falling through the cracks. If you've helped a parent or grandparent apply for Medicaid before, you know how confusing it already is. Now imagine that process being even slower and more difficult. Number 2, work requirements. The bill introduces work requirements for able-bodied adults, but here's the catch. Some seniors under age 65 who receive Medicaid due to early retirement, disability, or caregiver status could be affected. That includes people in their late 50s or early 60s caring for a spouse, individuals who retired early due to illness but don't yet qualify for Medicare, or low-income grandparents raising grandchildren. If these folks can't meet the work requirement or prove they're exempt, they can lose Medicaid coverage entirely. Number 3, state budget strain equals reduced benefits. Because Medicaid is federal and state funded, when the federal government cuts its share, states either have to fill in the gap or cut programs. Now here's 4 things that could get slashed at the state level. Number 1, home and community-based services like in-home nursing and meal delivery. Number 2, assisted living subsidies for low-income seniors. Number 3, nursing home reimbursements, which could force facilities to close, especially in rural areas. And number 4, dental and vision coverage, which many states already consider optional under Medicaid. And we're not talking about 5 or 10 states. Experts estimate that 30 plus states may have to reduce optional Medicaid benefits just to balance their budgets. Number 4, increased burden on families. When Medicaid support gets cut or delayed, families have to step in, and that oftentimes means adult children dipping into savings to pay for care, more seniors moving in with adult children, or women, especially daughters, leaving the workforce to become full-time caregivers. It's a domino effect. The Medicaid cuts in this bill don't just hit the government programs, they hit families, they hit the middle class, and they hit caregivers. So if you're thinking, I'm on Medicare, I don't need to worry about Medicaid, remember this: half of all people in nursing homes are on Medicaid, and millions more rely on it for the care they receive at home. The truth is, Medicare only pays for short-term skilled nursing care. If you need months or years of help with bathing, dressing, eating, or medications, that's where Medicaid comes in. And if that system is underfunded, you're either paying out of pocket or going without. And for most families, neither of those is a great option. All right, now let's talk about what may be the most confusing part of the one big beautiful bill: the Social Security tax elimination. No more income tax on Social Security. That sounds incredible, right? No more income tax on Social Security sounds like a dream. But here's the truth: this bill does not eliminate the tax on Social Security. What it actually does is offer a temporary federal tax deduction, and only for some retirees. Let's break it down. Number 1, it's a deduction, not a full exemption. If you're over age 65 and earn less than $75,000 per year or $150,000 as a couple, you'll get a deduction of up to $6,000 or $12,000 per couple off your taxable income. But it doesn't remove the tax, it just lowers it a bit. If you're already below the taxable threshold for Social Security, this deduction does nothing for you. And if you're above those income limits, the deduction phases out completely. So this only helps a slice of middle income retirees for a few years. And that brings us to the second problem: it's temporary. This deduction expires at the end of 2028, unless Congress renews it. Unless Congress renews it, your Social Security income goes back to being taxed the exact same way it was before. So calling this a tax elimination is misleading. It's a temporary break, not a permanent tax relief. And number 3, the $1 more retirement trap. Now here's the really dangerous part. This new deduction may push some retirees into what's called the $1 more trap. Let's say your income is $74,999. You qualify for the full deduction. But if you take $1 extra out of your IRA or pension, you hit $75,000 and you lose the full deduction. That same income bump could also increase how much of your Social Security is taxed, raise your Medicare Part B premiums due to IRMA, or trigger higher taxes on capital gains. So instead of helping seniors, this deduction could actually punish them for earning more. This is why tax planning and retirement is more important now than ever before. A small change in income could cost you thousands in lost deductions or increased premiums. So if you've been told this bill eliminates taxes on Social Security, it really doesn't. It temporarily lowers them for some people and then creates a lot of financial traps for others. All right, now that we've walked through the law itself, the cuts to Medicare and Medicaid, and the truth about Social Security taxes, let's talk about what you can do about all of this. Because while the one big beautiful bill is now law, that doesn't mean you're powerless. In fact, the people who stay informed and act early are the ones who will be affected the least. Let's go over 5 action steps that you need to take today to protect yourself, your finances, and your healthcare. Step 1, talk to your financial advisor. This law changes the game. So whether retired or planning to retire soon, you need to reevaluate your income strategy, plan around the Social Security tax deduction and income thresholds, and watch out for the $1 more trap that could raise your Medicare premiums or trigger new taxes. So if you don't have a retirement savvy tax advisor, now's the time to find one. Step 2, lock in the best Medicare coverage while you can. With cuts to Medicare provider reimbursements on the horizon, now is the time to make sure your doctors accept your current plan, compare Medicare Advantage to Medigap while networks are still stable, and consider hospital indemnity or home health care riders to fill future gaps. It's better to lock in stable coverage now than to wait until the system starts showing cracks. Step 3, help your parents or loved ones plan for Medicaid. If you have aging parents or relatives who may need long-term care in the next 5 to 10 years, help them start gathering documentation now, help them learn about Medicaid's 5-year look-back rule, and help them consider long-term care insurance if they qualify. Delays and denials are coming. Preparation is the only defense. Step 4, contact your representatives. Tell them how these cuts affect you. Whether it's good or negative, whether you're a fan or you're not a fan of the bill, you have a voice. Call, email, show up at town hall. Your voice matters, no matter if you approve this bill or you do not approve of this bill. And step 5, stay informed. This law is the start of major changes. So subscribe to this channel, join my newsletter, and stay connected. I break this stuff down every single week, so you're not caught off guard by sudden changes in benefits, taxes, or eligibility. Now, before we wrap up, if you're someone who is on Medicare or nearing retirement and planning on getting onto Medicare, I want to personally invite you to call me to schedule a free one-on-one call to go over your specific situation. We help people every single day navigate their Medicare options, and the best part is it's 100% free of charge. So if you call into our number, I will personally go over your doctors, your medications, and your pharmacies with all the plans in your area. And we can even help you enroll at no cost whatsoever. So if that's something you'd be interested in, feel free to call the number on the screen or use the calendar booking link in the comment section below. I'd love to meet with you. And if you found this video helpful, hit that like button, share it with someone on Medicare, and leave a comment below telling me how this law might affect you. And remember, when you understand the rules, you can make them work for you. Thanks so much for watching. Go check out one of these other videos where we dive into different parts of Medicare. I'll see you over there.